Hi, I'm Dr. Felice Gersh, your integrative physician, here in my office in Irvine, California, talking to you on living in the age of coronavirus. Thank you for joining me, and for those of you who are new to my show, I'd like to just tell you who I am. I am an integrative physician specializing in the care of people of all ages with a primary focus on women, but I also see men. I like to think of myself as looking at the root cause of illness, not just trying to cover up symptoms, although symptoms are not good either, but I want to try to help everyone to optimize their health by looking at what is really causing the problems that they're suffering from. We are now facing a pandemic that we have now been living with here in the US for over a couple of months. Our lives have been changed so much. And I'd like to talk to you today about a topic that you may think, well, what on earth does that have to do with the man in the moon? What does it have to do with coronavirus? The topic is oral health. Well, it's not at all unrelated. In fact, it's incredibly related. I am a medical doctor. I went to medical school at USC. I learned pretty much nothing about the mouth. I was told, you don't need to know about the mouth. The mouth is what dentists take care of. You know, you're an MD. You don't think about the mouth. Well, unfortunately, that is not the case. Every doctor, every person needs to be thinking about the health of their oral cavity, the mouth. Now, why is that? What's so unique about the mouth? Well, the mouth is actually part of the GI tract, the alimentary system, and it starts the process of digestion in your mouth. A lot of people think it's not important. I mean, you could just juice everything. Well, actually, I'm not in favor of that. I talk against doing too much of the juicing, too many smoothies, because the reason we have a mouth full of teeth, and hopefully they stay that way, we keep our teeth, is because our food should be masticated. It should be chewed. And what happens when we chew our food? Well, it tells our brains, guess what? We're eating. And then when the brain realizes we're eating, it's going to then do signaling to the organs of the lower part. You know, the mouth is here, but we get down into the gallbladder, the pancreas, the liver, the stomach. All of those organs get clued in by the brain through signaling that food is coming. So when food arrives in the stomach is prepared. It's already producing more stomach acid. The pancreas is getting ready to release its digestive enzymes. The gallbladder will contract and release the bile and cholesterol. All of that is happening, and the liver is on alert because it's going to get involved in the act as well. So all of these organs work together in unison. But if you do not chew your food, the brain isn't going to give all these clues out. And it matters because how we are as a person, our overall health is very, very much dependent on what we eat. But not just what we eat, what we absorb, what our intestines actually get out of the food and turn into the basic elemental nutrients that our bodies can absorb through the villi, those little fingers in the small intestine that take in those nutrients. And as well, we actually make all kinds of things in our intestinal tract. We make neurotransmitters, we make hormones, we actually even make vitamins. All of this is made in our intestinal tract, but only when it's working properly. So that's why it is so important that we do all the right things, and it starts in the mouth. If you have an unhealthy mouth, it won't matter if you chew or not, because let me tell you some of the things that happen when you have an unhealthy mouth. You have the wrong microbiome of your oral cavity. Now, we are just learning the incredible importance of having the right gut microbiome, the home to trillions, predominantly in the colon, but also there's a microbiome of the stomach, there's a microbiome of the small intestine. Every system in the body has its own special microbial population that we call the microbiome, the collective genome of all of the little critters that live within that area. Well, the mouth, it turns out, is incredibly important in terms of its microbiome. But due to the things that we have done, for example, using toothpaste that is really unfortunately toxic, mouthwashes, eating the wrong foods, and putting other things in our mouth that are harmful to the microbiome, at least half of people now have an abnormal mouth microbiome, the oral cavity. Now, it's amazing what these microbes do for us. It's a beautiful synergy between what they do and what we do and how we work together to both thrive when things are right. So it turns out that the mouth microbiome produces certain enzymes. These enzymes are called reductases. Now, just as a clue, if a word ends in ase, it means it's an enzyme. So that's a clue. So these are reductases. So what do? They take the nitrates that are in the green leafy vegetables that we eat and beets, and I'll tell you why beets are one of my favorite vegetables. So it takes these nitrates and converts them through the reduction process using this enzyme reductase from nitrates into nitrites. So nitrites, a lot of people think, oh, nitrites are so bad for you. They put them in things like bacon and so on. Well, it turns out that nitrites, if you have the right things going on in your gut, it's not going to stay as nitrites. It's going to actually be converted into nitric oxide. It's a gas. It's one of the few gas signaling agents in the body, and it's what we call a redox agent. It works on reduction, oxidation. It works as an antioxidant, and it's critical for the health of your vascular system. Now you're thinking, oh, we're getting into the vascular system. You know the coronavirus has a big impact on the vascular system. You've probably heard that the ACE2 enzyme, that is how the virus gets into our cells by binding to this enzyme that's on the cell membrane, converting it into what is called a functional receptor. And it gets into the cell and it disables that enzyme. Well, that enzyme is present, that ACE2 enzyme, on many, many cells in the body, all throughout the body, including in the lining of arteries, the vasculature, that incredible group of structures all over the body that deliver nutrients and oxygen. And that's how we fight infections. We carry our white blood cells, the fighters of the body, the lymphocytes, the neutrophils, the macrophages, all of those important leukocytes, the white blood cells. They get carried in the blood through the vascular system to the site of infection, and then through this miraculous stuff that goes on in the vascular system, the capillaries and the small arteries, they change their permeability to allow the white blood cells to transmigrate, to exit from the vascular system into the surrounding extracellular matrix, the surrounding tissue, to actually bind to viruses and cells that are being impaired or damaged by the virus, to then gobble them up through this process called phagocytosis. None of that can happen properly if you don't have healthy blood vessels. Nitric oxide, much of it is made in the vessels, but much of it is made in the gut through having this process of converting the nitrates in our vegetables into nitrites, which then in the stomach through another process, and that involves having stomach acid and magnesium and B12 and zinc and calcium. All this is necessary. And also further south in the intestinal tract as well, the nitrites get converted into nitric oxide. And it's an amazing process. And some of the nitrates that don't get converted, they get reabsorbed, they go back through the salivary glands, and then they get converted into nitrites. It's now you get it. It's so important to have a healthy gut microbiome, because you can't convert. That first initial critically important step to convert nitrates into nitrites won't happen unless you have the right microbial population in your mouth. Then, once you make the nitric oxide in your stomach or south in other parts of your intestinal tract, it diffuses. It's a gas. It diffuses out into the circulation, and then it goes around the body to do all these wonderful things that help to keep our tissues really healthy. Now, also, nitric oxide is important for the health of the heart and also the health of the brain. And you've probably heard the coronavirus can actually hurt the brain. It can actually hurt the heart. So we definitely need nitric oxide, this amazing antioxidant gas, to actually help neutralize the free radicals, the oxidative stress, this inflammatory process that occurs in the heart and in the brain, of course, throughout the blood vessels. What happens if you have a lot of inflammation in your blood vessels? You are more prone to thrombophilic events, thrombotic events. That means blood clotting. You've probably heard people who get the coronavirus infection, some of them create lots of little blood clots and sometimes big blood clots that break off and can travel, creating strokes or even a heart attack. But the stroke has been the biggest part of the problem. So we do not want to have blood clots, that is for sure. Well, when you have an unhealthy vascular system, because you don't have enough nitric oxide and you have inflammation from the virus that's involving the endothelial, the lining of the arteries, that's double trouble. You have this inflammatory process combined with lack of the antidote, the antioxidant nitric oxide gas. So that creates havoc. Now, this is an interesting thing. I have not seen any studies. I haven't even seen anybody even thinking about the role of the mouth, the oral microbiome, and coronavirus infections. You know that there are some people, they say, we don't know why this person had such a terrible adverse reaction to being infected with the coronavirus. Some people do okay. Why did this person who has no apparent existing disease states, the things that are considered to be pre-existing comorbidities like hypertension, diabetes, obesity, and so forth, that they don't have any of that, and yet they had a very horrible reaction. Their infection was very, very severe. Maybe they even died from the coronavirus, and nobody knows why. Well, maybe their mouth microbiome wasn't right, and they weren't able to make enough nitric oxide to counter the inflammatory effects of the coronavirus in the vasculature in particular. Also, we know that it's so important to have a healthy mouth microbiome to have a healthy mouth in general. So what happens when you don't have a healthy mouth microbiome? You get gingivitis. Okay, so gingivitis is inflammation and low-grade infection in the gums, and it's associated with resorption of the bone of the jaw and of the teeth. And that's why teeth start to fall out, because the bone that secures the teeth in the jaw starts to erode and disappear. And so there's nothing to hold the teeth into the jaw. And that happens with gingivitis when you don't have the right the right mouth microbiome. Well, a lot of people think of this as an aging process because it tends to be that old people are the ones that lose their teeth. And that is true. And why is that? Well, because it turns out that hormones, particularly estrogen, is very key to having the healthy bone in the mouth, and estrogen is very important for reducing infections and inflammation. So this is another area that absolutely deserves tremendous attention, is the role of estrogen. Now, testosterone converts to estrogen, and men, their testosterone tends to decline with age. So their estrogen level actually also declines, but it's a local estrogen. It's produced locally as opposed to circulating. So perhaps people can have a much healthier mouth and maintain their teeth and lower their problems with their oral microbiome if they had adequate estrogen and testosterone for males. So this is really important. Now, how can this play also into coronavirus? Well, we know that elderly people also have one of the highest death rates and morbidities from infections with coronavirus. They're also the ones who tend to have a lot of gingivitis and dental problems in terms of tooth loss. Well, this is an interesting thing that you may not know, but when you have the wrong mouth bacteria, they can actually seed into the blood and they actually circulate in the body. You actually get this bacteremia, the bad bacteria in the mouth circulate through the blood vessels, and they can actually get into the plaque and create unstable plaque by creating inflammation, an infection. So what happens is the bacteria can get into the already inflamed, you have already an unhealthy state, the bacteria from the mouth circulating get into this inflamed developing plaque. And then even more white blood cells come to the scene because that's how our bodies are programmed. If you have bacteria, the immune system gets activated, it calls in the troops through this process that's called chemokines. So the troops come flooding into the area, creating more inflammation and unstable plaque that can cause ruptured plaque. Also, when you get that state of inflammation, what else does that do? It increases the risk of blood clots. It also causes vasoconstriction, a lot of vasoconstriction, so you have poor blood flow to vital organs like the kidneys or the brain. This is like a really big deal. So maybe a lot of the very bad outcomes, even deaths of the elderly people, may be due to the impact of an abnormal mouth microbiota with gingivitis, poor dental health, loss of a lot of bone, creating more inflammation, and then you have the seeding of the blood with these abnormal bacteria, which actually gets into the lining of the arteries, creating more inflammation. Now, we're talking about what can happen even without coronavirus. That is one of the leading causes, now we know, of heart attacks, is having an unhealthy mouth. I don't know if you knew that connection between an unhealthy mouth and a heart attack, but it's very, very proven. But what if you now add coronavirus into this very complicated and very unhealthy situation? You now have the coronavirus that's causing inflammation in the artery lining, the endothelial lining, on top of having this inflammatory process from the bacteria from the mouth, the bad bacteria, getting into the inflamed lining that is happening in older people who don't have enough hormones. So now you add, fuel to the fire, and you're taking the unhealthy arteries and making them that much more unhealthy. So that could be why when you already have this unhealthy, really very dangerous kind of setup within the arteries of elderly people, and then you add in the problem of coronavirus creating more inflammation, more instability, and then on top of that you add the fact that you don't have enough hormones, so you're not making nitric oxide in your arteries, and you don't have the right mouth microbiome. So even if you're eating a healthy diet, which a lot of people aren't, the healthy vitamins and nutrients and everything else from your vegetables isn't getting absorbed because you're not getting proper digestion. And then on top of that, you're not making enough nitric oxide, so you don't have the right mouth microbiota with the enzyme reductase to convert the nitrates to nitrites, which then have to be converted in the stomach to nitric oxide, but it requires adequate stomach acid and all these other nutrients, which may also be missing in older people. So you can see it's the perfect setup for disaster. So what are we going to do about this? I don't want to just be all about bad news. Well, one thing is older people could talk to their doctor or find a doctor that understands hormones and looks at their hormones, actually measures them and looks at the potential to replace hormones, because that is important. Number 2, you do not, if possible, take a drug that blocks stomach acid, because the nitrites that you do make have to be converted to nitric oxide, and you need some stomach acid. So that's one thing. Another is zinc. Now, you've probably heard a lot of talk about zinc, because zinc helps to block the enzyme that gets blended. So the enzyme that gets bonded, the ACE2 enzyme, is a metallo type of enzyme, metal, that needs zinc. So if you give a lot of zinc, it helps that enzyme to actually help block or repel the virus trying to attach to it, and turning it into a receptor. So zinc is very helpful. Well, it turns out that zinc is also very helpful for making nitric oxide. So that's another reason why taking zinc can be very beneficial in general. And so zinc is something that is very important. Like I said, there's not a lot of foods that we're eating, enough foods that have zinc. So, at least look at a multivitamin that it has some zinc in it, or you can take it as a supplement. And so what else can we do? Well, we need to have stomach acid. We need to have a healthy mouth. So you need to find a really good dentist, okay? This is not optional. The dentist you hook up with can make the difference literally between life and death. So you need to have very good cleanings regularly. If you're an older person, probably older meaning like over 50 or so, we start being old around 50, remember menopause for women, you want to have a dental cleaning about every 3 to 4 months. You really want to try to clean out the plaque. The plaque is formed, do you ever think, what is plaque in your mouth? What is that? That's actually a biofilm made by bacteria. So if you're making a lot of plaque, it means you have a lot of wrong bacteria in your mouth that is creating these biofilms. Well, you need to clear out those biofilms, and that helps get rid of the bad bacteria. That's what you need to have a deep cleaning for, if necessary, to really get rid of that plaque. That's the biofilm of the bacteria. So deep cleanings are great. You need to get a nice organic toothpaste and a nice soft toothbrush. Maybe get a water pick to really get in between your teeth. Make sure you work with a really qualified hygienist to help teach you really good oral health care. This is really important, not just for a beautiful smile, but also for a healthy heart, healthy brain, healthy vasculature throughout the body. So you definitely need to do all of that. Please don't use commercial toothpaste that have all kinds of bad things in it, like triclosan. These can be killers. They're actually antimicrobial agents. So that's why I want you to use a nice organic type of toothpaste that doesn't have any of those chemicals. Preservatives are there to kill bacteria. Remember, the mouth microbiome is made up of bacteria. So you don't want to use a lot of preservatives in your mouth because you're going to kill your healthy bacteria. Also, mouthwashes. Please don't use commercial mouthwashes, the ordinary mouthwashes, because they are killing not just the bad bacteria, they're killing the good bacteria. So we need to look into what you're actually putting in your mouth. You can swish with saline solution. You can also do what's called oil pulling. There's not a ton of research on it, but you can take like coconut oil and turn it into liquid, like just heat it up so that it's just gently warm and it's liquid. And then you put it in your mouth and you just swoosh it all around between your teeth, and you really work your tongue, and you just swoosh it every which way all around your mouth, and then you can spit it out. And then you could also rinse very well with nice, clear, purified water, okay? That is really, really helpful. Make sure, like I said, you get a water pick, get in between the teeth, massage the gums. Don't use anything too harsh or too dangerous in terms of damaging your fine, gums. We don't want to hurt them. And that's why I said getting a really great hygienist and a really good dentist to really team up with for excellent oral health is so important. I am not a big fan of fluoride, especially not in adults. That's really something that has been a big concern. A lot of research now has gone into looking at fluorinated water in cities, and there's now been many reports saying that they have been overdosing people for some time by putting far too much fluoride in the water. You have to keep in mind fluoride is a halogen, if you look at the chemistry tables, and it can compete with iodine and knock it off. so that you can actually end up, if you have too much fluoride, you can actually have an iodine deficiency in your body. And iodine is essential for many, many important functions involving your breast health, involving ovarian health, brain health, and of course, thyroid health. So fluoride, I would say to really limit, and especially for adults that they don't need it, but I definitely would defer to your dentist on what you should use. But I just want you to know, be careful about fluoride. It can be overdosed, and they're now saying many water systems in the country have put far too much fluoride into the water. Think about what you are using in your mouth if you're getting any kind of braces. Some of the nice ones that look so pretty because they're clear, they may be made out of BPA, and we don't want to necessarily put endocrine disruptors in our mouth that dissolve and get into our system. So definitely talk with your orthodontist too to see if you can find the most natural and safe products that are going to be sitting in your mouth. In terms of mercury fillings, they are problematic. Nobody's using mercury, as far as I know, any longer. If possible, if you need a dental filling, try to get ceramic. Try not to. The silver fillings are not silver. They're made out of mercury. Now, over time, they can be somewhat absorbed into the body. A lot of people do dental dental treatments to remove all of that mercury. But that has to be done very carefully by a dentist who actually is taking a lot of precautions, because you can actually release more mercury. And sometimes it's best just to leave it in place. Usually over time they have to be replaced anyway because they're so old, and usually there's either additional decay or cracking of the teeth from having them in there. But when they are replaced, make sure the dentist is very careful, because it will release mercury, and then they're replaced with ceramic fillings. So you can see the mouth is not actually a very simple place. It's very complex, involves a very elaborate, very unique microbiome. The health of the gums and teeth and the jaw that the teeth are implanted into is all incredibly healthy. I want to make one comment about bisphosphonates. These are the drugs that are given to many women in menopause to try to prevent fractures from osteoporosis. I'm not a big fan. They dramatically increase the incidence of osteonecrosis. It's like a crumbling of the jawbone, and most dentists don't want to touch women with like dental implants or any kind of work in women who've been on those drugs, because they know that the jaw is often very, very unhealthy, the bone of the jaw, and very unstable. There are better ways to help bone health. That'll be a talk for another day. So I want you to know that the mouth is actually connected to coronavirus, something you probably did not know. And I want to just answer one question, because it's one that is very important to me, and it was, what can you do naturally to help reduce bad breath? Because that comes up, right? So one thing is to have a healthy stomach. A lot of times it's food sitting in the stomach that actually comes up. People don't realize that it's actually gases made in the stomach that come out the mouth, right? So you want to make sure you have adequate stomach acid and that you eat the right foods, lots of vegetables, lots of plants, because that will help keep everything south in your mouth from, you don't want to have like sewer gases coming up through your mouth. You don't even know that that's happening. In terms of in your mouth, what can you do? You can do some very simple things. Like one thing is my favorite is get some fennel seed. You can just get that in the spice section of your grocery store. So you get fennel seed. Now it tastes a little bit like licorice. I happen to really like the taste. You can also get anise seeds, and you chew on fennel seeds or you chew on anise seeds, and they're very healthy for you. They're actually very good for the gut. They can actually help with people who have some gas issues. And you just chew on these little fennel seeds or anise seeds, and your mouth will smell really nice. So that is another tip for the day. So thank you so much for joining me on this journey into looking at the mouth and its connection to coronavirus. So you'll know you need to eat lots of green leafy vegetables, because that's, by the way, where the nitrates come from, as well as beets. I can't not end with mentioning my love of beets. I try to eat beets every day. The beet roots, now the leaves of the beets are great too. Beetroot is wonderful as a source of nitrates, as a source ultimately of nitric oxide. So try to eat beets every day. They are truly delicious and can be eaten hot or cold. So I look forward to seeing you again next week for my next episode of Living in the Age of Coronavirus. Thank you so much. Stay well, stay safe.